Hi, my name's Kim. I'm a specialized Chinese medical provider and Taoist practitioner, and this channel is all about you, sharing with you information and solutions from the ancient Chinese cabinet of healing remedies and helping you figure out how to use those solutions in your everyday life. Today, I am finally swinging back to helping your heart stay healthy. And this is the second episode in that series. We're going to talk about why looking at your capabilities is so important to your heart health. And then we are going to talk about 2 great supplements you can use that have a great impact on heart health and longevity. So let's jump into it. There is a lot of conversation out there today on how to improve your heart health. Supplements, eating, exercise, and many of us believe more is better. I don't hear a lot of conversation on capabilities. And capabilities are what we want to do versus what we can do. And without that conversation, all your good intentions could end up in disaster. One of my clients came in this week who had used their social distancing time to get in better shape and improve their health. And what an effective use of time, and a great way to burn off a little excess stress and anxiety. Everything was looking great. He was losing the weight, he was shrinking his inches, just crushing it. And then he came in this week.
A warning had appeared. I could feel it in his pulses. It was a noise lifting up from the pulse, willing to be heard. A change in the heart pulse, signaling trouble. If damage to an internal body organ had a scale of 1 to 4, 1 would be that you are in good shape with no major issues. 2 would be you're damaging your organs. 3 would be you're about to have a significant incident, but you're probably going to survive. And 4 would be you will have a significant event and probably not survive.
In the last 2 weeks, he had moved from a 1 to 2.5. And most of the time we move along this continuum and completely discredit what's happening to our body. In fact, Western medicine helps us think this way. Daily medications eliminate the symptoms so that we can continue doing what we're doing. They make life convenient and comfortable. They don't hold us accountable for our actions. I just put an episode out on the first law of karma that reflects on how our desire for convenience and comfort can waylay our health. And Western medicine allows you to discredit inconvenient information. Although that's not usually the best solution. I have an episode out here on finding balance, the reciprocal link between mindfulness and Taoism, which looks at truth and why it's essential to incorporate as many different angles as possible in your life. The thing about medications is they change your physical capabilities. Medications reduce your physical abilities but allow you to believe that your physical capabilities are more generous than they are. And a great example is acid reflux medications. That medication allows you to believe that you can continue to eat whatever you want until the acid reflux gets so bad that even the medication can't stop it. When your doctor tells you to exercise and lose weight, you don't get a prevention team to help you monitor and make the best decisions for you. Instead, you're pretty much out there on your own unless you're using something like Chinese medicine, whose goal is wellness and not prevention. And in my office, and I'm sure there's a lot of other Chinese medical providers who offer something similar, but I offer a monthly wellness program where we establish what your goals are, and on a monthly basis we review your progress, we assess where your current strengths and weaknesses are, and you get professional advice to help you attain the goals that you're trying to accomplish. And this is especially important as we've gotten older and our health isn't what it used to be and needs different attention and direction. And when you start with any life-changing healthcare, you may want to come in more frequent, because my client had a significant change in only 2 weeks. So my client's been crushing it. He's been losing weight, shedding inches, and everything's looking excellent. And he comes in this week and he's looking fantastic and he's feeling pumped because he's been doing so great with all his successes. And then I look at his tongue and take his pulses, and that's when I hear it in his pulse, that warning. And so I ask him, hey, have you been doing a lot of heavy cardio?
Yeah, crushing it.
Okay, so what rate have you been getting your heart rate to?
110% of max, crushing it.
Here's the problem. Your heart doesn't have the same flexibility it did when you were younger. And if you're taking medications, and the more common ones are going to be blood pressure meds, corticosteroids, statins, they mask impaired organ function and they mislead you into believing your heart can work harder than it can. How many people do you know over 50 who are exercising, and some of them might be in great shape and have always been exercising, and suddenly they die of a heart attack? I've known more than I want to know, including my father, and my father was doing everything correctly. He was exercising, he had lost the weight, he was taking supplements, yet Western medicine couldn't help him identify when he had overdone it. I know my mother had thought something was wrong. She had scheduled him for an EKG, and it was 3 days before his EKG when he grabbed his chest and fell over. He had had a massive heart attack. When you're young, you can overdo it because it's hard to push past the limits of your health and vitality. You just have so much extra health and vitality. But as we get older, we've used a lot of that health and vitality, and it's much easier to push past our limits. If you're taking any type of medications, especially for your heart health is already a risk factor. You're taking those medications because you already have a problem in that area. The drugs are there to ensure that your body doesn't get too far out of balance. And then you start doing hard cardio, which pushes your body way beyond the limits of the medications. Can you see where that might not be a good idea? So what do?
Think about exercise that only slightly elevates your heart rate, like walking or swimming. And when you're doing cardio, only allow for a slight increase in exertion where your breathing has become faster, but you could do it for a long time. And at the end of your exercise, you won't be out of breath.
Rethink your food choices. How and what you eat can change on a daily basis because you change on a daily basis. Just because something worked for you yesterday doesn't mean it's going to work for you today. Add in Chinese medicine as your wellness coach to help you stay on track and adjust your lifestyle decisions based on where you are at that point in time. The real benefit of Chinese medicine is it's a comprehensive medicine based off of 5,000 years of history. Proactively supporting wellness is the designing principle of the medicine. The medicine's geared towards understanding small changes in the body that can lead to great disease. You don't have to wait for a heart attack or a stroke to address your wellness. The last thing that I want to talk about is supplements. And 2 supplements can be great for your heart health. The first one is magnesium, and the second one is vitamin C. There are a lot of reasons for low magnesium levels. Many of our common diseases are associated with low magnesium. Diabetes, osteoporosis, hypertension, coronary heart disease are all associated with low magnesium levels. One reason why these diseases may be more associated with low magnesium levels is because the kidneys handle reabsorption of magnesium in the body. The kidneys filter magnesium and either reabsorb it or eliminate it through urination. And so anything that impairs kidney function can impair the kidney's ability to maintain the proper level of magnesium in the body. In Chinese medicine, diabetes is predominantly a disease of the kidneys and spleen. And in Western medicine, the high blood sugar levels can damage the blood vessels of the kidneys, leading to high blood pressure. And the kidneys have a responsibility to manage the blood pressure of the body. So any damage to the kidneys is kind of like a double whammy on the high blood pressure. And the last part with high blood pressure is high blood pressure can damage the arteries of the kidneys, so further weakening the kidneys. In Chinese medicine, there's a central axis between the heart and the kidneys. Any imbalance in one will cause an imbalance in the other. In Western medicine, recent research has supported the Chinese medical theory. These two organs are intricately involved with each other and mutually dependent. The heart supplies a mandatory blood flow to the kidneys, whereas the kidneys manage blood pressure and filter out impurities from the blood. Heart failure is the leading cause of kidney disease. And how it does this is through its reduced pumping action. And that reduction in pumping action allows blood to pool in the vein between the heart and the kidneys. The American Heart Association estimates 100 million people have high blood pressure. Another 37 million people have chronic kidney disease. And the CDC thinks that there's 30 million people out there that are diabetic and another 70 million people who are pre-diabetic. These are pretty huge numbers. So you can start to see why magnesium deficiency is so common. If I had to choose one supplement for heart health, the one that I would choose would be magnesium. And the type of magnesium which has the highest uptake in the heart muscle is magnesium chloride, which tastes like pure poison. Yet it's the best one to start taking, and I would take it for about a month and then switch to something else. If you have a lot of chronic issues or are a heavy drinker or smoker, I've found that starting and stopping supplements can cause more problems. Because when your system is severely compromised, throwing it a lifeline and then yanking it away can dysregulate the system. It's kind of like teasing. Nobody likes teasing. The last supplement I'm going to talk about is vitamin C, because vitamin C is an antioxidant, and antioxidants fight free radical damage. Some people refer to aging as the gradual accumulation of free radical damage, and all the diseases we just talked about create free radical damage. But that's not the only reason why I like vitamin C. Vitamin C is one of the few supplements which eliminates heavy metals from the body, especially aluminum. And there's some research out there that suggests that aluminum gets prioritized in the body over magnesium on the receptors that uptake magnesium, forcing the kidneys to filter out magnesium. 4 things from this episode. First, exercise with wisdom and compassion. Second, magnesium chloride. Third, vitamin C. And fourth, incorporate Chinese medicine proactive wellness coaching into your regime. Okay guys, until next time, I'll catch you on the other side.